We'll now call the work session, June 13, 2024, to order, please.
Councilmember Hyde. Councilmember Jackson.
Here.
Councilmember White. Vice Mayor.
Here. First on the agenda, discussion regarding the YMCA.
Yes.
Is he putting something?
Yeah, if you could come up and give a brief overview of what he's looking to do, that would be lovely.
Yes, I'm Dave McHenry, president of Y, and this is Heath Frazier. He's the vice president, and Hal Green is Hal Green's the vice president. He's on the phone, and this is Heath. He's our secretary treasurer. Over the last year and a half or 2 years, we've been having discussions with the city about the possibility of buying our building back. Everybody's aware that in 2016, the city paid off some loans that were in default, and we deeded the building back to the city, which was in accordance with the loan agreements at that time. We now are trying to get the building back. One of the issues we're funding is with our contributors and our grantors who are giving us grant money are wanting us to get something resolved with the building. We only have, starting in July 1, there's only 2 more years left on the original 10-year lease, which at this point was non-renewable. So our funders and our contributors are concerned of what's going to happen at the end of the 2-year period about the building. So we've made an offer to buy it back, and we've asked to come in front of council. We will try to answer any questions that you guys have at this point in time.
Question. What is the long-term plan, after you buy the building back? It's still going to be the YMCA?
Yeah, we will continue to be a YMCA. We plan on doing that. We're hoping to do some expansion and more improvements to the building. We did a significant amount of improvements since we've been leasing the building. We have handled all of the maintenance costs over that period of time, and we're hoping to expand. We're trying to expand our day program. Actually, even the possibility at some point of starting a full day program. Right now we have a summer camp program and an after school program at the Nutter Ford Elementary School, and we're talking to some other schools in the county about running the program through their schools.
Fantastic.
So all these other health clubs have not put a hurting on the Y?
I'm sorry, I can speak up a little bit. I've had a little trouble hearing today.
All these other health clubs around the area, Bridge, West Virginia Fitness, haven't put a damper on things at the Y?
Yeah, they've had an effect on us. The biggest one probably was the Bridge. We lost several membership during the Bridge. Our membership right now over the last year has been fairly steady. That's why what we're trying to do is look to other areas to provide our service, like the daycare area and those type of areas where it doesn't involve a membership. It's actually where we get a fee for providing the service. So that's where we feel our growth going forward will be, not necessarily in a lot more members, but providing our services in other areas and working more with maybe some of the other nonprofits in the areas of where we can provide service to them. We do have a couple of foundations that we've been talking to about working with getting some high school kids. This foundation would fund a membership for high school kids to come for a year and try it out, and they've agreed that if we can get that program going, they will provide the funding for that program.
Can you explain to us who maybe weren't here in 2016 exactly what the circumstances were behind defaulting on the loans?
I can't hear you.
I'm sorry. Can you explain to us, for those who weren't here in 2016, what exactly the situation was behind defaulting on the loans and what's preventing that from happening in the future going forward? What has changed? What have you guys done differently?
Well, one thing is we have not borrowed any money except we have we have a capital lease on equipment which we bought when we refurbished the thing. We have had it for 2.5 years. We got another 2.5 years. We made the payments on time, every payment, we're not behind. Our only other outside debt is during COVID, the SBA was providing working capital loans to organizations to help them through it. We did get a $150,000 SBA loan. We paid interest for 2 years on that loan. We also are up to date on that. We're making payments every month. And that loan actually we use for deals, and then when we get the receipts in, we put the money back in. So we still have majority of that, 140,000 of that we still have to use for working capital out of the original 150. That loan has a balance of about $140,000 on it now. The lease was for the equipment was originally 150, and it's down to about 75,000 now. So we paid, and we're up to date on all those. We're up to date on all of our current bills. And our 13 thing happened, they wanted to be assured that we would keep that time. We've paid everything on time for the last 4 years since I've been involved with as the treasurer and as the president of the board. We paid every bill we've had on time.
Thank you.
Have you all identified any outside funding streams, any grants or anything like that you'll be able to utilize to help with this process?
He's talking
Yes,
about, he's
we
worked
have.
a lot
So
on that.
I've worked pretty heavy over the last 6 or 7 months in my capacity to identify many revenue streams that are all hinging on us having the ownership of the complex. And we're not talking 5 or tens of thousands of dollars, we're talking 7 figures that we could help bring wealth to the city of Clarksburg, reestablish our relationship with the city, and be a catalyst really for a lot of what I know the council members sitting here at the table would like to see happen in this town, to see us flourish. And we truly believe the Y should be a cornerstone in that. It has been for 40 years. There's no reason we should ever go away into the sunset.
You know, another area we have done is we actually have applied for a grant through Senator Capito's office to help with some of the repairs. One of the biggest issues we have is the water supply going from down below the hill up to the facility. We've had several breaks over the years. We've applied for a grant through it's called Congressional Directed Funds to replace that water line, and we're waiting to hear back on that. So that's one of the ones that we're hoping for. That's about at least $120,000 if we get it to finish the water line.
Now, I know when I was growing up, the YMCA was a place that we spent a lot of time because it was down here on Pike Street, and we were those underprivileged children. Is there any plans in place to reach out to the underprivileged community so that individuals will be able to access the YMCA up on top of the hill and use those facilities?
Yes, sir. So I sit on the board of Sacred Heart as well, and there are a few other board members that are deeply entrenched in the Monticello community as well as Northview and Adamston communities. And our target is to reach those children and give them access to the Y facilities, and have going Central Bus as well about possibly establishing a bus route throughout town up to the building and out to give them access where they may not have a family member that can drive them up there. Our main goal is to really expand the services we provide to those people in the community that wouldn't otherwise have access to a bridge or another facility of the sort. And we know that that's the Y's niche nationwide to fulfill our mission for responsibility across all social strata. So our goal and our intent is to expand all of those services once we have full ownership of the facility and the surrounding property.
Our day camp program is already a good example of that. We have about 100 kids a daily up there now. At least 25% of those kids are child who the state actually subsidizes a portion or 100% of their daycare. We're a licensed facility, so we're able to do that because we're allowed to operate 5 days a week since we're licensed. If you're like the bridge, It's not licensed, so they can only offer daycare 4 days a week, so we're able to offer 5 days a week. And those individuals come. The other part of that is 2 years ago, we met with the state, and we are actually a food distribution facility for the state through a grant that the state provides. So all of our children in our daycare program get meals a day while they're at the day program, and the state pays that cost. And that's about $40,000 a year for the kids for the summer, so it's a pretty significant number. And it's not, and it affects all the children in the program. It doesn't just the ones that are needy. It's a program that allows anybody. We hope to someday expand that to anybody can come stop by during those hours in a meal, and the state would pay for that, but we're not equipped quite yet to do that, but we hope to do that some. Within, maybe next summer, we'll be able to do that.
Does the Y still facilitate the youth basketball program that they used to have?
We do have one, yes. We're actually in the midst of reestablishing our church basketball leagues as well. So keep an eye out for that.
And what we did
instead.
there was we actually did just through a grant through Dick's Sporting Goods in conjunction with one of our larger contributors. We just redid the whole basketball floor. It was getting pretty bad shape, had some dead spots. We completely redid it, repainted it and everything. It's really, really nice now. So when the kids do come back for the program, they'll have a really nice gym to work in.
Anybody else? Mr. Howell, you have anything?
No, I'm good right now.
I know we have Hal Green on the horn here.
Hal, would you like to add anything, sir?
You know, it's, I just appreciate that council is taking this seriously and giving us fair consideration. There's really, I have to listen to everything. I think it's such a broad subject, really. And, we really hope you all, see this in a positive light and enable us to continue what the WISE mission is. And I believe that mission is something that's part of, goes hand in hand with the city and with the county. And, you know, over the years, maybe, especially in the last 15, maybe we lost a little bit of our focus. I think the people that are there now, Heath Frazier and Dave McHenry and myself, but we have a pretty strong board of directors, very, very active, and we've identified what we need to do to get the Y back on course, and I think we're already there. But the hindrance right now is the property and the building, because we can't go and ask for money without having that available to us. So.
I got kind of a statement, but I feel confident moving forward with the YMCA because you can't really compare them to other fitness clubs or gyms, because I think you guys have a mission to go after that it will allow you to alternate paths and where other gyms are struggling, the other, like the bridge and other things coming in. I think you guys don't have to focus just on the fitness part to survive. So I think I have confidence moving forward, things that I've heard working with you guys the last 2 years. So I'm confident moving forward because you guys have different routes to take.
Appreciate your sentiment.
So what do you find your financial stability is right now overall?
Overall, right now, we're like I say, we're in good shape. We have not had to use the working capital loan we got for a number of the improvements we've done. We've been able to do that with contributions from foundations, individuals. Just to give you an example, since 2017, we've actually had $1.5 million worth of contributions from the community and another $300,000 worth of grants from various grantees in this area. So we need to continue that, obviously, to continue to be viable. That's one of the reasons we feel we need to get the building back so that we can continue 2 or 3 of those larger individuals who have given really do want us to get the building back. They do not feel comfortable with us not having ownership of the building. So that's the main reason that we really do need, so we have control. So if we do need to expand, if the opportunity came to do a daycare, we would need obviously to do some major repairs or put a new building up, and we would obviously would not be able to do that without having ownership of the building and the land around it that we originally had.
How much was the working capital loan, the amount? How much was it for?
It was for $150,000.
And you didn't spend any of it?
I'm sorry, I didn't hear the last
You
one.
did not spend any of it?
We have about 140 of it that we maintain. It might go down to 60 or 70 as we pay certain bills, and then once we get reimbursement from the state, like for both the choice program and the food program I mentioned, we have to pay the labor in a month, but then by the end of the next month, the state's reimbursed us for those costs. So we have a lapse in when we spend the money because the bulk of our expenses are about 60 to 70% of our expenses are labor, and especially in a school program and a summer camp, we have, all the counselors are there now, and we're paying them over the next 2 or 3 weeks, but about 25% we will not get paid until next month for them when we bill the state.
How much was the capital lease for?
How much is what?
The capital lease?
For the equipment?
Yes.
It was $150,000 worth of equipment we bought, and we paid about half of that off now. It's about $75,000, I think, is what we owe on the principal on that.
And how much longer does that go? The
About
length?
2.5 more years. It was a
2.5 more
5-year capital lease. At the end of the lease, we will own the equipment, and we figure that we'll be able to use it at least for another 5 to 7 years before we need to replace it again. The equipment does not get a severe use up there from our members and other people, so it lasts a good while.
Are your financials public?
What?
Are your financial statements public? Like, is it something we could see?
Yeah, we file a 990
Okay.
with the IRS
Yeah.
every year. And that people can go on.
Yeah.
We're still working on our 2000 last year's, but the year before that, if anybody wants a copy, they can write to us or give us a call. We would send them a copy. We
Okay.
maintain a copy that we can make a copy of and electronically send to anybody that they want.
Okay.
We have we want to have clear disclosure to everybody, so we'll give it to anybody that requests the financials.
Well, I don't know about all the other council members, but I'm for this sale with the stipulation that the city has first refusal.
Yeah, well, Jim, that has been in every deed that's passed to now that we've given there, or you've given back, that has been a part of those deeds. We are perfectly okay with that. We understand that situation, and we would totally agree to having that stipulation in any deeds the city had with us.
I mean, God forbid if the Weiss would go under, we certainly don't need a pipe yard up there.
Yeah. I agree, and, if you really look at the deed close, I think probably not a whole lot can be done with it because it has to be used for recreational according to what I've read in the deeds, that when it originally was deeded over the first time to us, there was a stipulation that it had to be continued to be used for recreational for the rest of its life. So, but like I say, we wholeheartedly would agree to that stipulation as we have in the past without any issues.
Let me add as well that our vision is not hindered to that hillside. While that is paramount in us getting additional funding through grant resources, through private equity companies that would like to invest in the city of Clarksburg through the Y, our vision is expanding beyond that building, moving into the downtown area, possibly moving into other areas of town as we have extensions and outlets that we could serve the communities directly where they're at, instead of forcing them to come to us to provide resources to them. Expanding beyond just physical fitness, getting into adding assistance with mental health, with veterans, with at-risk youth. The sky's the limit in the Y partners with organizations throughout the country. We can tap into their resources and their leadership and pull the same vision that they've had in other cities. And we feel that we're really poised to do that. This is just the first step in the process.
Yeah, we actually have, our Y franchise actually includes Lewis County, Doddridge County, Taylor County, Marion County, and maybe one more, Harrison, of course. So we could move to those counties. Actually, we've actually had preliminary talks with both Taylor County and Lewis County about having some services there. Neither one of those would be a full Y, but it might be some services. We've actually did a few things with Lewis County in the summer with their children's program down there. The children come out to a park on a daily basis, and we've actually had a couple things that we did with them on that. And so we'll continue to talk to those organizations as, the opportunity becomes available. We actually, before COVID, were actually licensed to do a after-school program in 2 of the Lewis County schools. Unfortunately, they changed superintendents, and we lost that license, but we're talking to them again about maybe reinstituting that and getting licensed to go ahead and move back into those 2 schools in Lewis County.
And our clear vision, though, is to be married to Clarksburg, and that's what we've always been for longer than I've been alive. So it's important to us that everyone in the community, satellites bound, that they know that the hub is here, and that Clarksburg will always be our vision and our desire to see this area grow and flourish and be a part of that.
Mr. Green, you have anything else you'd like to add, sir?
No, Jim. I think they've covered from what I can tell.
Okay. Council, anybody else have anything?
So, has the Y discussed the purchase price to receive the property?
We have. I believe we presented an offer to the city.
Yes. Yeah, we presented an offer to, originally, it was $100,000 and to be paid $10,000 each year over the next 10 years to help us with the cash flow. Then we were asked to revise that offer, and we revised it till and we felt we could do it. We talked to some funding sources. We feel we can pay $50,000 first and then $10,000 a year for the next 5 years. And we've already discussed it with our full board of directors. They would be in favor of approving that offer if we could, get an agreement with the city and get the appropriate paperwork done. Our board would in fact approve it. Wouldn't have to be any issues about whether the board would approve it or not.
Anyone else? Thank you, Jim.
Thank you.
Thank you, Mr. Green.
You're welcome, Jim. I was on you. Sorry,
Goodbye.
Thanks, Howard.
everyone.
Thank you.
So for this one, everybody has a package. Melissa was here from the negotiations, and then we discussed it.
Article 3, discussion regarding social workers' proposal.
Good evening. Thank you all for your time. And I have a video.
This is Marissa Rexroad for everybody, or
Yes.
Russell now, from United Way.
I feel like Paul's looking at me in that picture right now.
hope despite having been stressful times. Housing is our focus here, but resiliency is a close second. There's no clean one-size-fits-all solution to what we're experiencing here in Harrison County, but we believe in our community and its people, and we believe that we're resilient. Our goal is to help folks move past the monolithic perspectives of this population and get curious about why so many people struggle to maintain housing in our community in the first place. On the surface, it's easy to say that the issue is
So
primarily
Melissa, can you put
substance
that
use,
microphone
but if you
down
dig
to the
deeper,
speaker
what you'll
on the
find is much
computer,
harder to
please?
digest. The reality is that substance use is one common issue amongst those struggling with homelessness, but most of the time, it's simply one of the many symptoms of trauma, of adverse childhood experiences, of toxic stress. Trauma is the common thread you'll find baked into almost every case. If we're to change the trajectory of folks experiencing a high volume of trauma, we have to provide healthy and stable environments and foster healthy connections and relationships that bolster resilience, among many other things. In the spring of 2020, right as the COVID-19 pandemic was beginning, we launched our solution-focused street outreach program. A few months later, we launched our county's first local rapid rehousing program. Ending homelessness is a collective responsibility, which includes those experiencing homelessness taking personal responsibility and accountability and becoming self-sufficient. If we're to drive systems change, we have to create spaces where providers can step back together and critically examine the work. We have to continuously ask ourselves, what did we set out to do here? What did we learn? And how fast can we improve on it? The work itself is messy and complex, and we certainly don't have all of the answers. But I am personally committed to asking questions, experimenting, and driving continuous improvement as we work toward our ultimate goal of implementing a unified homeless and housing system that ensures homelessness is rare, brief, and non-reoccurring in Harrison County. That video was prepared in 2021, back when I won a West Virginia Beacon Award for my work here in Clarksburg with homeless population. And it gives you an idea of what street outreach looks like on a daily basis, and it gives you an idea of how we follow clients from the street into housing. And as soon as we have our slides here. So I'm the director of the Resilience Collaborative of United Way. The Resilience Collaborative is situated inside of the United Way of Harrison and Doddridge counties. We launched and were formed in April of 2020, sort of right as COVID-19 had taken hold. And we have been working within the United Way for the last 4 years. And developing different programs to address both homelessness and housing instability here in Harrison County. Tonight, I'm here to talk with you about an integrated social work and street outreach initiative for substance use disorders in partnership with the Clarksburg Police Department. This is building on the solution-focused street outreach programming that we have been operating here in Clarksburg and throughout Harrison County over the course of the last 4 years. And I think it's really important when we talk about these issues because they are messy, right? And these disorders are really disorders of powerlessness, right? Addiction has a way of making folks feel like they no longer have control, right? And an ability to address it. And I think it's important to remember that although the world is full of suffering, it is also full of the overcoming of it. And we are in the midst of a very messy spot in our community, but there are so many reasons to be hopeful because there are so many people that I see day in, day out come so far. And we're certainly committed to making sure that there's always a pathway out for those folks. So our agenda tonight, I'm going to tell you a bit about our mission, our team, the funders and partners that we work with throughout our community, our programs. I'm going to tell you about some statistics and some success stories, our approach to the work and the proposal. We'll also take some questions at the end. I also have some of our partners here tonight, primarily Dr. Kyle Miller, who is a family medicine and addiction medicine provider at Community Care of West Virginia, and we work very closely with Miller and his team. Our mission at ResCo is to ultimately work with folks who have experienced homelessness and housing instability. We use a variety of approaches in doing this. We specialize in street outreach, housing placement and test management, healthcare connection coordination, service benefit connection, and the stabilization of highly vulnerable segments of the population. So ultimately, our street outreach program has served as a way to of people with homelessness in our community and to prioritize them for services. So looking at in the beginning are, does this person have medical vulnerabilities? Do they have children? Do they have serious mental illness and will not ever be able to resolve, on their own without a good bit of support? Are they living with a substance use disorder? And those are factors that we're taking into consideration. And ultimately, it's our goal to practice and teach the art of bouncing back after failure, loss, and trauma. Because as I said in the video, that is the one thing that is baked into each and every one of these cases. And that the things we see on top, the substance use disorder, the difficult behaviors, those things are often just larger symptoms of really deep wounds. Our team, you'll see myself and my co-founder, Tom Ryan, who's also our director of our medical respite care program. He's a registered nurse. Many of you know Brad Riffey. He's the face of our organization at United Way. We have 2 new street outreach specialists and case managers who are tasked with covering the county and supporting the Harrison County Sheriff's Department in their substance use disorder response. And this is just a few of the team of volunteers that keep us rocking and rolling. Our partners and funders, we are partnered with WVU Medicine United Hospital Center to provide our medical respite care program. We also assist with a lot of their homelessness and housing instability cases. Folks who wind up inpatient, have medical vulnerabilities, and are having some sort of housing instability, we're able to step into that case and help stabilize their housing and provide integrated clinical and social service support. We work very closely with Community Care of West Virginia and through their family medicine and their addiction medicine programs, and we're plugging folks back into evidence-based programs that are accessible to them here in our community. We work very closely with West Virginia Wesleyan Center for Restorative Justice. They're with us each and every Friday at the First United Methodist Church for our housing, hygiene, and healthcare clinic. They run healing circle conversations there every Friday. And that's a space for folks to feel seen, valued, and heard. They also cook a hot meal in collaboration with many of our clients who are housed now and are looking for ways to give back. First United Methodist Church is an integral partner in our work as they provide us the space necessary to provide many of these services. Clarksburg Police Department, we work closely with the department, and this proposal is our hope to expand on that relationship and to be able to provide them additional supportive services that we know that there is a need for. The Harrison County Day Report Center, we're lucky to partner with them and have some support staff that support us in our work with things like job coaching and employment readiness. The Harrison County Sheriff's Department, we have a partnership with them to work to embed our street outreach staff with their department to assist with substance use disorder, mental health de-escalation, and other complex social situations. The West Virginia Coalition to End Homelessness, we've been a partner of theirs for the last 4 years, and we're an invisible door to the coordinated entry system, a virtual door to accessing those services and getting on the engagement list there. The Antero Foundation is one of our integral partners, as well as the Claude Worthington Benedum Foundation, who funds our medical respite diversion program. United Way of Harrison and Doddridge counties does fund part of our work as well. And we function much like a funded partner of the United Way. Though we are situated inside, our finances are completely separate, and we function programmatically in the same way that many of our funded partners do in relation to our agency. And then the United Health Foundation, which also supports our medical respite work. What we do. The first program that I talked with you about and what you see showcased in the video is our Solution-Focused Street Outreach program. Solution-Focused Street Outreach is at the center of this proposal. And it's an assertive and intention housing-focused process that is designed to meet people where they are experiencing outdoor homelessness and to work toward resolution. Resolution looks different in each and every case. All of these cases are incredibly unique, and oftentimes this involves things like vital document recovery, housing search and application, linkage to inpatient and outpatient supports, linkage back to primary care, behavioral health care, helping folks reestablish those connections in the community, working to build a network of support around them. Simultaneously, this involves things like shelter placement. Of course, if there's willingness to do that, we're able to find a shelter bed. We have relationships with shelters throughout the region. A note to say that shelter is becoming increasingly difficult as we're seeing that infrastructure really struggle across the state of West Virginia. But the thing that we are to, and we're able to provide that support. We do a lot of connection to both inpatient and outpatient addiction treatment programs through our street outreach program. We spend a lot of time building community and rapport with folks, building trust with them, where trust is not earned in big, heroic deeds. Trust is earned through a small, iterative process of going back to that person over and over and showing genuine care and working to connect with them on a level that others may not be connecting with them on a regular basis, and helping them to see that there's a way out. So for a lot of these folks, they are in the thick of it, in terms of their addiction. They've burned many of their bridges, and they can't see what could possibly be out there next for them. So a lot of our work is doing that psychoeducation to help them envision what could their life be like if they were to choose to stop using substances today, or to take stock of what is the effect of substances on your life today. What is the cost? Through this project, we're able to provide a hot meal and healing circle conversations every Friday at 2 p.m. We also provide hygiene services. Our goal through street outreach is to help folks meet basic needs for things like healthcare, hygiene, housing. We're also looking and working constantly to take action on a broad set of social and economic factors that influence their overall well-being and their economic security. Outreach is targeted to folks who are experiencing outdoor homelessness in Harrison County. We do cover the county, though we have a limited amount of staff capacity, and so right now we're primarily focused in downtown Clarksburg, and that has been the case over the course of the last 4 years that we've been in operation. And much of that is because this is the epicenter of unsheltered homelessness, certainly in our county. There are other hotspots that pop up throughout the county in Shinston and Salem, and we do our best to address those things. But certainly the breadth of the population is here in Clarksburg. Our medical respite program is the first in the state of West Virginia. This is a national model that's been employed across the country. This is funded in partnership with the United Hospital Center, and the aim of this project is to address folks who are experiencing medical issues or who are medically fragile and also experiencing homelessness or housing instability. So a lot of these cases involve folks who, have been working full time but are right on the poverty line and, out of nowhere get something like a cancer diagnosis, wind up in the hospital for a couple of months, not able to pay your rent, and now you're on the verge of eviction, right? And that's when we're able to step into the case, stabilize their housing, ensure that they have all of the benefits necessary, and then work to integrate those social and clinical services so that those folks have a place to discharge home to and have the care that they need in order to stabilize in housing. This can also work both ways. So we are funded to do diversion work on the medical respite side now as well, which means that if you are medically fragile and you're experiencing outdoor homelessness, and we locate you, we're able to triage you and prioritize you for this program, in which we'll provide short-term residential care, working towards housing placement with those integrated clinical services provided on site, and connection to all of your specialty providers, your medications, all of that jazz. ER going to wind up there unnecessary. We have our Families First partnership. This is a partnership with the Harrison County Board of Education, and this allows us to provide emergency shelter options to families with school children who are enrolled in a Harrison County school, and to facilitate expedited housing placement, and provide customized supports that foster resilience along the way. Ultimately, this program is really designed to help folks, families experiencing homelessness, maintain access to their home school while they are experiencing that time and working back towards housing placement. In lieu of this program, if we did not have this, what we saw before we developed this partnership with the Board of Education was that students who became homeless in our county were being sent to shelters outside of the county and then bused back to their home school, which is just an extra layer of difficulty on top of an already difficult time. Our Homebound program, this is an integrative case management program that's designed to facilitate permanent stable housing placement. So if we're going to take you from street to housing, we're going to roll you from street outreach into our Homebound program. And this program provides customized supports that foster resilience and housing stability. This is a very intensive and integrated program. And we act as a liaison with the landlord, so we're communicating with them and making sure that our folks have everything that they need to be successful, and we're doing a lot of coaching alongside of them. This is everything from budgeting and financial literacy to connection to healthcare, behavioral health care with ongoing coordination as needed, helping to maintain benefits, things like that. And then lastly, our Rebound program. This is a skills-based program that's designed to assist people in bouncing back from hardship. So this is designed to meet people who are experiencing housing instability and to provide them short-term case management alongside some financial assistance to stabilize their household. And then the sort of homeless proofing and coaching necessary that their household does not become this, and that we're able to catch them before that crisis occurs. So thus far in 2024, we've housed 32 folks at stable settings. We've sheltered 39 individuals through our partnership with the Board of Education and through our medical respite care programs. And I believe 10 of those were children. Well, unfortunately, my slide got cut off there. We have connected 14 people from the street to inpatient substance use disorder treatment. We've made 16 new connections to primary care. So those were 16 individuals who were either not engaging with a primary care provider at all or who were getting their health care through the ER system. We've made 8 new connections to mental health care and 10 new connections to specialty health care. And we've had 0 returns to homelessness of the 32 folks that we've housed over the course of the last 6 months. In 2023, we housed 50 individuals in permanent stable settings. We sheltered 17 children during that time, 17 individuals during that time, 8 of whom were children. We connected 26 individuals to inpatient substance use disorder treatment and provided 24 individuals with integrated healthcare and housing case management. This data looks a little different because I started to break it out differently this year in terms of mental health care, primary health care, and behavioral. And in 2023, we had 1 return to homelessness out of the 50 that we housed. Our approach is really simple. We meet folks where they are, right? We do our best to build trust and rapport with folks where they are living and to help them assess the extent and the impact that substance use disorder and PTSD have had in their life, and to work to help them regain control. Helping them to establish safety in their lives, that's sort of the first step and the foundation for any therapeutic work that we want to build on top of that. Working with folks to eliminate self-harm, to gain control over their overwhelming symptoms, and to remove themselves from dangerous situations, and working through a slow, iterative process of building trust to get to this place. What does this look like? This looks like asking these questions that I referenced earlier. You know, what would your life look like if you gave up substances? What would be the hardest part? How can I support you through that? What areas of your life are currently affected by SUD? Let's put that down on paper. Let's talk through that. What's the cost of continued use, and what do you most want help with? And sometimes that's the starting point, right? Sometimes it's, hey, I need an ID. You know, I have my birth certificate, I need help getting my social, and I need help getting an ID. And sometimes that's the first step of me building a relationship with that person. Supporting the messy middle. This is where we're managing massive vulnerability, right? This is a person who's taking a risk to change their lives, and they do not know what's coming next, right? And so it's a very vulnerable, risky place to be. It feels very scary. I have a friend in recovery who says to me all the time, the brain seeks the familiar. And I think that's so incredibly true, right? That whatever we are used to living in, our brain seeks that, right? And that's what feels normal and good to us, right? Comfortable. And so when we're going through this messy middle part, we have to remember that, we have to go forward, but the brain would feel more comfortable going backwards, right? So it's a really difficult process. A lot of loneliness and uncertainty here. A lot of what comes next. It's best to do this in an inpatient, highly structured setting. There's a lot of mourning that goes alongside of this. Mourning of that time that they lost, mourning the impacts to relationships that they might not be able to recover, grieving deep wounds and facing how trauma and substance use disorder may have alienated that person from themselves, from their family, from the people that they love. This looks like performing a lot of trust-earning behaviors and working really hard to show up for that person in the small moments, and helping them to piece a narrative together of what happened, and being both a witness and an ally, and helping them face the devastation that's been inflicted by trauma and substance use disorder. The next step is rebuilding. This is really hard work. This is early recovery. This is envisioning and creating a new life, and there is so much trial and error that goes into this phase, and our role is to be unconditional in our ability to show up for that person and to be with them through this process. This is new goals, roles, and activities, new people, places, and things, and continuing that healing process through the work with helping professionals and making new connections to healthcare providers. This is also the place where we make that jump to permanent stable housing, right? And working towards things like employment, job training, meaningful daily activities, community building. Most of these folks who are in new recovery, they may not know anybody else who is new in recovery that they are close to. And helping them to build new, supportive, healthy relationships, bolstering those protective factors, and offering highly integrative, intensive support, fostering that connection of network to a network of providers. And that's really the time where we're building, I may have been the person that had that relationship with that individual, and now my role is to support that person as best I can, but also to build a network of support and leverage the rapport that I've built with that person to bridge it to a person like Dr. Miller. In our proposal, you'll see that we're asking for one licensed clinical social worker to operate alongside 2 professional case managers. We're asking for financial support for the project over a 3-year period. This would occur through a joint application to the West Virginia First Foundation and the City of Clarksburg Opioid Fund, so it's sort of a co-applicant situation. We're supporting the integration of this approach within the police department. We're ready to offer 24/7 on-call support and I've outlined the annual cost here. Of course, you have a larger budget in your packets, as well as some more detailed program descriptions that you all have, and I'm certainly happy to answer any questions you might have about that. There are many organizations that have moved in this direction in terms of making these services more available at street level. I am a firm believer and can tell you that in almost all of these cases, what you see is an extensive trauma history. And if we can make that kind of therapy accessible to folks at street level, and we can provide evidence-based treatment and work to build an awareness for the need of a higher level of care and work to build that trust and that rapport, I really feel that this will give us a leg up on reaching some of the folks that have been incredibly difficult to reach. Here in our community, we were really good at providing an emergency response to homelessness for many, many years. We were really good at putting people in a shelter bed and feeding them a warm meal and meeting their basic needs. We were not very good at thinking about what came next and thinking about how do we help support these folks to become our neighbor, and to regain control over their lives. Good pipeline, a good way of doing that. And many people were left homeless for far too long, right? And the impact to their lives has been very severe substance use disorder, a great deal of mental health conditions, a lot of trauma. The longer a person is homeless, the impacts all of this. And now, we have a core group of folks who are chronically homeless, who are living within our city, and certainly my opinion is that they have been failed by the safety net in so many ways, most of them starting when they were very young children. And I believe that we have a duty to make sure that they get the help that they need. And so often, I think the troubling symptoms that we're seeing on top are symptoms of a larger issue that we just don't see the root of. It's like a fever when you're sick. They're telling us they need help. And I feel strongly that if we're able to fund this proposal and provide trauma therapy at street level, that we will see results within that specific segment of chronically homeless individuals who have been continuously homeless in our downtown for many years. Questions?
How many homeless are there that know or?
So we are working with well over 75 people right now in the middle of, within downtown Clarksburg who are coming in and out of our clinic. We need to do a summer point-in-time count, and I'm working on that. What we do right now is an annual point-in-time count, which is done the fourth week of, I believe it's the last Wednesday in January each year, and that's a count that's mandated by HUD. I really don't love that data because it's a very cold time of year, and a lot of people are inside. In the summertime, we certainly see a ballooning of this population, there's no doubt.
Marissa, do these people, I mean, do they want to get back up on their feet? I mean, are they just, you know, you said some of them have been homeless for years. I mean, do they want to? Do they have to want to?
Sure. I totally hear what you're saying, and believe me, I have pushed the elephant up the hill far too many times. I do believe that most of these people want help. I haven't met one person who has said, this is the way I want to live. I think that they need a lot of support to see that there is a different path, you know, that there is another way of living. And I think that they need help that I can't always provide them. You know, I do my best to build therapeutic relationships with folks, to be a person that they can talk to, you know, about these things. But ultimately, you know, if we were to do a study on adverse childhood experience scores within this population, you would see an off-the-chart set of data.
Melissa, you mentioned quite a few times about meeting these individuals where they are. However, you know, always on the street isn't the best place to meet them. Do you all occupy enough space down at the United Way where these individuals will be able to come in and sit down and meet with the caseworkers?
We sure do, and we already have that. Just so y'all know, our space is in First United Methodist Church, which is over here on North 2nd Street. I've been there for about the last 2 years, and that's where my offices are, the Resco offices, and we have a large space there in the fellowship hall, and we have individual offices where we can meet folks, and we're already doing work on a daily basis. So we have folks who come in for appointments every day and see us inside of our offices, and then we operate a clinic a week. We're working to expand that to twice a week, where folks come in, they can get a shower, they can get a hot meal, they can talk with a case manager. And that's been really key because ultimately there is such a lack of dignity within this population, right? It's really hard for me to say to you, you know, Hattie, I know that you have that wound on your leg and we really need to get you to a doctor. And then you say to me, well, I smell really bad today, right? And I don't feel comfortable, right, going in. And that's really valid, right? So if we're going to help these folks connect to those things, we have to also work to help them restore that dignity that has been lost in the process.
On question 4, it asked to describe your requested project as to how this would connect with the emergency services personnel. Can you explain to us how you actually see that, foresee that working? If you have these individuals who are working under your umbrella, how do you make that connection if the officers are out on the street and they need one of the case managers or the social worker? How does that connection work?
Well, I'll tell you, I think that every social worker at UHC and every police officer in the city of Clarksburg has my cell phone number. But we're already making those connections. So when the police department needs us, when the hospital needs us, we're a phone call away. They give us a call and we're there, you know. I am within the city of Clarksburg 7 days a week. I live on Washington Avenue. My office is over here on 2nd Street. And it's a very similar situation with our staff. So the idea with this program would be that we would be available to them 24/7. So a staff person would be on call. Kitty and I have talked through this about what would work best, and we've talked a little bit about radios and different things like that, but they would be available by phone call and they would be within the city limits. And part of that idea is, the idea of this is that there's some value in operating separately from the police department, and there's tremendous value in operating together. Right? We are partners already. That's not going to go anywhere. It's not going to change. This allows us to expand that partnership and offer more direct support to police, but it's also good for folks to see us as separate from the police, right? We're there to build rapport and to build a relationship with them, and the idea is that after we've done that, we can leverage that into other relationships, right? But oftentimes, you know, folks who are in the thick of addiction, right, seeing a police officer come down the street is not necessarily something that might be reassuring to you, right? So keeping those things with a degree of separation can often be a good thing.
Okay, now, you've already received $100,000 from the county, and you're asking for these monies right here. And that means that you would have a social worker and 4 caseworkers under your, somebody would be supervising those individuals. Who would be overseeing these individuals?
Oversee these individuals. Now, the partnership that we have with the county, so the street outreach providers that we have hired in partnership with the county will be embedding with the sheriff's department. Very similar to what we're talking about tonight with us and the city of Clarksburg's police department. The idea is that, you know, those folks are experiencing just as many calls around substance use disorder and mental health de-escalation and all of those things, and they need assistance with that. The other thing I'll also say about those two is that over the course of the last 4 years, we have done our best to get out into the county, but we have spent the majority of our time, the vast majority by far, within the Clarksburg, because there is such tremendous need here, and we have had 2 up until about 2 weeks ago. So we are very aware need out and not been able to adequately address, and those staff are very much focused on getting out into the county, into places that are far more rural, where there are far fewer services relations. So this proposal would put 2 individuals on the street Monday through Friday within the city of Clarksburg.
Can you tell us a little about your credentials as far as overseeing individuals who are, you know, an LSCSW?
Sure.
What are your credentials as far as overseeing, you know, in that field?
Sure. I'm not an LCSW. I have programs. I have a degree in political science. I have profit industry since I graduated. I've worked for the West Virginia Community Development Hub. I've also worked for the Monongalia County Child Advocacy Center in the role of Director of Development. From there, I took a year off when my son was born, and then I became the Associate Director at the Clarksburg Mission, where I worked for a little over a year and a half before stepping into this role. I have worked blood, sweat, and tears to develop these programs and to implement them to the best of my ability, and I work with men who have a great deal of experience in providing evidence-based services. So in no way, shape, or form am I a therapist. That's not my role, but I work with a great deal of folks who provide those services, and I pull them in and do my best to make those services accessible to all of our population.
Let's talk about the West Virginia First Foundation.
Sure.
It sounds like to me how the application we submitted, once their process is established, is that saying that right now there's no process for us or you to apply for these funds?
I'll answer that, Mr. Hyman, if that's okay. So their process is supposed to be open, so that'll give us time to draft and laid out. I have talked to the executive director, Jonathan Board, about the proposal. He thinks it's a great proposal. It fits completely with the MOU and what they're looking for in a partnership. So we will be one of the first in line, if not the first in line, for a submission.
Sure, I appreciate that. Thank you. The second is a little more difficult. You may be aware that it seems like the city and have a rocky relationship with the First United Methodist Church, specifically regarding Friends Feeding Friends, other things going on. Can you tell me, I guess, why or what do you think would make this work better, having it completely housed over there for your sake? I mean, you know, I understand. Well, go ahead. I'll just let you answer. I'm sorry.
Having what housed over at the church? I'm sorry, I didn't quite understand well.
The different things that happen over there. Obviously, it sounds like you listed a few here in your presentation. We know that there's some friends over there, and now, you know, according to this, it says there's going to be walk-ins on Fridays. And it sounds like you're headquartered over there, right?
Yes,
Okay.
I have actually been headquartered over there for many years. Yeah, and I've been running this clinic there for 2 solid years. And, you know, to be honest, guys, I do not have anything to do with Friends Feeding Friends or the other organizations that operate out of First United Methodist Church. We operate independently. I don't have any wires that cross with them. And so they're certainly their own entity, and I'm glad that they're doing what they're doing. And I'm staying in my own lane on that.
Can I add to that I've checked with Police Chief Kitty if there's been complaints about Fridays, people coming and going. There's never been complaints about that aspect of the Methodist Church. The complaints have really been centered around what happens on Wednesday evenings.
Sure.
And I will also say that our clinic, again, the foundation of our clinic is about restoring dignity, right? And so the way that we restore dignity is by providing people a private way to access services where they can get the services they need, see a healthcare provider, talk to a case manager, get a shower, and get a warm meal. I'm a firm believer in using things like a shower and a warm meal as a magnet to have the assertive, intensive conversations that we need to have about getting to a resolution, right? But at the end of the day, the foundation of our clinic is to do that in a way that restores dignity, first and foremost.
I certainly agree. I guess my concern to people who may disagree with that
Sure.
would be the fact that the city would now be subsidizing to a certain extent. And, I think there'd be several people in our community that probably disagree with that. I certainly don't, but, at the end of the day.
Yeah, I will say that none of the costs associated with this proposal would support that clinic. Would it be really great to have a trauma therapist working there, building rapport with folks? 100% it would be. And I invite anyone to come down and see what that work looks like. And I think you'll get a feel for, what we're trying to do there. But that is a good place to connect with folks. It's certainly a good place to have a trauma therapist.
Is that church actually the best place in town to actually have a facility like that? Because, right now, we're getting a lot of pushback from just the feeding program that they have over there. And so what you're talking about now is opening this up and making this like the space where individuals are going to be showing up, Monday, and where the services are going to be. This is almost like turning it into the mission, 2.0. And so, all the pushback that we're getting from the businesses and things over there, is that the best location for it? Is that the only location that you have to work out of?
I couldn't disagree more with your statement, Councilman Jackson, because this exists now. This has been operating in this exact same way for 2 years. I ran this clinic today from 12 to 3. Did anyone notice?
But see, that's one of the areas of concern for me as well, because, you run it from 12 to 3, but, individuals on the street who are in addiction, they don't run by a timeline. They want help. They want help like right now.
Right.
So,
That's when we have walk-in hours, is from 12 to 3, and the rest of the time, we would be meeting folks where they are performing street outreach. So we run that clinic one time a week from 12 to 3. We have done it for 2 years. Our neighbor is here, Shane Shreves. He owns the building right next door to our parking lot, and by far is the big audience to all of our efforts at First Church. And I can tell you that we work very well with our neighbors, and that we are constantly coaching and working with the folks that we're serving to make sure that they are, one, taking responsibility for their actions and ownership of themselves and what they, the way in which they behave. And two, making sure that folks are not lingering around, that folks come in, that they receive services, that they go and do, whatever it is that they plan to do for the rest of the day. We have not created a hangout spot, or, we've not had issues with people camping there or setting up tents or overdoses or any of those things. And we have been doing this work for 2 years. And nobody has had any issues with it. And I think what's different about our program and its foundation being rooted in restoring dignity is that you don't see me in front of the cameras or on the front page of the newspaper talking about the way that I do this work. The folks that need to find me know how to find me because I have taken the time to build street credibility with folks who live outside. And the way that they find me is through one another. I don't have to go out and shout from the rooftops what I do or when I do it. The folks who need our services, we have taken the time to build those relationships, that so much so that they share that connection with other people who need it.
Just to clarify though, these 3 new employees, they would not be housed at the church, right? As far
So-
as their office, or would they be at the United Way?
So we don't have direct service staff at the United Way office, and that's because there are a lot of children that come in and out of that building, right? It's the Board of Education building. It's probably not the best place for folks in the thick of substance use disorder to seek services, right? And so, which is why we have an alternate location for our direct services. Now, the folks that would be on this team, I understand that the chief would be willing to give them a place here at the police department to work out of. They would also be able to work interchangeably out of our offices as needed, right? For someone who this person may encounter, right, and then they want to have a follow-up conversation, or they want to come back and talk to them, they're not to them at the police department. That's just very unrealistic in terms of the way these relationships work.
So, the employees, you're looking at a social worker and 2 caseworkers, and you already have 2 caseworkers on board right now? Would the social worker oversee the operation of all of the caseworkers?
I don't know that would be the case. So these things are sort of separate, right? The licensed social worker, the reason why we need that licensed professional at street level is for them to be an actual mental health provider. If you have tried to access trauma therapy in our community, it is very, very difficult. It can take many, many months. These are not folks that we're going to get to an appointment ever, right? I can barely get them. There are many of them who I will never get to a primary care provider, let alone a therapy appointment that I have to schedule for 3.5 months down the road, right? So the idea of having this person is that they can flow amongst all of our cases and attach to ones who need trauma therapy or opiate use disorder treatment therapy treatment, and then they can see that person for an hour and then move on to their next therapy client. The case managers would be the ones who are working with them towards resolution, and these people would work, both of these individuals would work as a team in many ways, and they would communicate about those cases. But the idea is that this person will be providing mental health treatment across the caseload.
And for clarification, only within the city of Clarksburg boundaries?
Yes.
Whatever we're contributing to this one of the criteria in the MOU is going to be stated very clearly. They will not be able to participate in other cases in the county. This is the city of Clarksburg's program for the city of Clarksburg.
Yes.
How will that be differentiated and divided? Have you taken this program to the other municipalities to see if this is something that they would actually participate in and everybody actually was in? I know this is petty because it's about dollars, but if we're going to actually make this thing work, then why not reach out to all the municipalities to see, can we make this a county program and then actually make it work?
Well, I did start with the county, and the county has funded us to do this work alongside the Sheriff's Department, and that certainly is our intention with the 2 employees that we've hired. I've come to you all next because certainly this is the epicenter of unsheltered homelessness, right? So your willingness to buy in could be more than that of Bridgeport, right? Because it's not Bridgeport's problem. They're not experiencing this the way that we are, right? Which is why I've come to you. I've also come here because our operations have been centered in downtown Clarksburg over the course of the last 4 years, and we have a very good working relationship with your police department and a willingness and to expand and build on these support services. So Mark, and I'm sure Mark will answer any questions that you have as well, and I have worked very well, and we have a long-standing partnership, and we're willing to build this out and work towards that expansion. Now, my next, step is certainly to work towards meeting with folks in Chinston and to see what their willingness is and what kind of assistance they might need in addressing that issue. But I will say that I don't like to get into the habit of going into places where I haven't been operating and propose solutions, right? So I've been here operating for 4 years. I know this population very well. I know what has worked and what has not worked. I certainly will work to offer services in other municipalities, but I do not know Chinston the way that I know Clarksburg right now in terms of its homelessness issue.
But is this the epicenter of what we're dealing with because we keep offering all of the resources right here? Because, a lot of these individuals, how many of these people are actually from Clarksburg, and how many are coming in from the other municipalities into Clarksburg because we offer the resources here?
I think we all know this is a really hot button issue, right? And that's a big topic of conversation within this field of work. I'll say that it's a myth across the country that every community and every provider I've talked with struggles with this as a belief system in their community, that this problem is transient and it has come from somewhere else. I certainly don't have all of the answers to that, but I will tell you that we restore each person's birth certificate that we work with, and the vast majority of them are from here in Harrison County. I personally feel what is the most troubling sort of root to this myth is the fact that we have to reckon with that this problem might just be homegrown, that the trauma that these people experienced might have happened in our backyard, and we might bear some responsibility for that. And I think that there have been numerous studies on the way that the social fabric of our communities has begun to break down over the course of the last decade, how we're not as connected to be, how we don't talk to our neighbors as much as we used to. And I personally, it's my belief that the majority of this trauma and the reason why we are dealing with the people in the situations that they are in is because they have lived very difficult lives and they have lived them right next door to us.
Okay, and you said that your agency has been in existence for 4 years now?
So I'm a United Way of Harrison and Doddridge County's employee, and our agency, the Resilience Collaborative is a direct service program of the United Way. So we are within the United Way, which is over 50 years old.
Can you provide us data for that 4-year period?
Sure. Yep. I hit the highlights in this slide, but we've housed over 200 people in the course of that 4-year period. We've also brought in numerous federal grants that did not exist here in the county to provide evidence-based services over that time period.
And since you're on that subject, could you tell us a little bit about those grants? Obviously, with a 3-year buy-in, I guess.
Sure.
Would we be able to submit the city, or how would it be the United Way operation running?
Yeah,
Or at least our portion of it?
So we would be working, the United Way would be working to ensure the sustainability of the program, and that certainly is the goal. And there's a number of ways that we do that. We compete for Continuum of Care funding, which is HUD funding annually, as well as Emergency Solutions Grant funding. That's state funding. It's HUD funding that's passed through West Virginia CAD. We also are looking at SAMHSA funding. I think SAMHSA has a number of grants that are a really good fit for this type of project. And then, of course, we will be applying to the West Virginia First Foundation for additional support with a number of our other programs as well. We have foundation support from the Antero Foundation as well as the United Health Foundation And we've had that support from Antero for over 3 years. The United Health Foundation we gained last summer. And then we also have support from the Claude Worthington Benedum Foundation that we were just awarded, I believe, in March.
You guys done?
You guys done down there?
If somebody has questions, go.
A lot of my questions have kind of been asked, but I think as our role as a council member, we have to be selfishly in sometimes where we have to focus just on what helps our people in the
Sure.
city, outside of what we feel like we are, as individuals, trying to help everybody. But so right now you have 2 social workers, or 2
Street outreach
street
specialists.
outreach, and the county will be funding 2 more.
No, those are the 2.
But those 2 right now are focusing on primarily Clarksburg, right?
No. So we have 4 total staff. So we have myself, we have a registered nurse who moves across all of our cases just in the same way that this licensed clinical social worker would. And then we have the 2 new street outreach specialists that we've just hired who will cover the county. There are 4 of us total
So
right
they
now.
started yet? They start in July?
Started a week ago.
Okay. I think that for some reason, so when you were talking about earlier, your primary focus, you were talking about just you and.
Yes,
Good.
myself, yes, and our RN, we have been focused primarily in Clarksburg over the course of the last 4 years.
So my point is that, with us, we don't want to lose, so we put money in, we don't want to lose what's happening already.
Okay,
So
so.
we want everything, so we want everybody.
Don't-
I understand, and, obviously we are the center, but we just don't want this funding to go there and then opens up other things in somewhere else to where our meat is kind of just replacing other.
Sure. So what has happened over time? When I started this work, I was the only employee. I wrote all of our grants and built these programs, and I did all of the direct service myself. And I think about a year into that, we hired Tom Ryan. And what has happened over time is that we have remained a staff of 2. And we have been over capacity the entire time, been a huge caseload, far too big for 2 people. We've carried it the best, but at the same time, larger grants, there are more requirements to those grants. It takes more time to administer that funding, more time to report on it, more time to build the relationships that we need to build to make this system work as a whole. So at this point, I'm doing more of that systems work, right? Partnerships with the hospital and the Board of Education, building a pipeline to housing, making sure that those providers who need us most know us, making sure that we have people like Dr. Miller in our corner for the moment that we need them. And so a lot of my work goes into sustainability, overseeing those cases. To the best of my ability, up until a week ago, I was carrying a caseload. I'm working on no longer doing that. But I guess all of this to say, I used to spend every day at street level, and now can rarely get out there. I can rarely get out there because I have so many people coming in to see me. What happens when you house all of these folks is that they don't say a lot. So like we build a network around them, they're still their touch point. There are many of these cases of people who are living with things like schizophrenia, serious mental illness, who I will be attached to their case probably until, I don't know, I'm in a nursing home. But, because I built that trust and rapport with them, right? And it doesn't mean that I'm responsible for their day-to-day care. We've built that network around them. They have in-home care workers. They have primary care providers. They have psych providers. They have people who bring their medicine. But at the end of the day, folks need family. Folks need community connectedness, right? And part of our job is that we're doing that community build work, and all of these folks that we house, are still connected to us. So, not only do we have all these folks on the street, but each and every one of them that we've housing, we're still a touch point for them. We still have a responsibility to them, and we certainly are still in good contact with them. And I think, we have Shane Shreves here, who's one of our key landlords, and Shane can tell you how long we are with these folks and what our relationship looks like with them, because it's not as simple as putting someone in housing. Putting someone in housing is the easiest part of the job. It's keeping them housed, working them through those challenges, being that supportive person with them through all of that trial and error, and making sure that, we can help folks be good neighbors, that we can help them become self-sufficient, that we can help them get back out there and be productive members of our community. And yeah, they're just like us. They just want to be connected and to feel loved and to have someone who's genuinely concerned for them, right? So if I house them, the likelihood is that they're still on my caseload.
So why did the county not follow the route of, also getting matching funds from the foundation and going for a longer period of time? Because $100,000, that's going to operate for 1 year. Is that what you said? Or
Yeah, I can answer that, Marissa. This is my proposal, funding it that way, and I did that for a couple of reasons. A, we need a longer program. B, I'm very, very much in favor of building a relationship with the West Virginia First Foundation, because this is the first proposal. We'll see it's successful, and the next proposal and the next proposal, they'll be more inclined to fund, because Clarksburg is setting a standard to putting programs in place with boots on the ground that achieve results.
could the county not modify their, approach towards it is a longer period of time? Because I don't,
Well,
a year, I mean, I know
yeah,
everyone could build relationships. A year,
No
I
doubt.
mean, that'd be very stressful.
100%, and I totally agree with you on that. And to be quite honest, that I was not involved in the development of that. So yeah, I'm not sure how that developed that way, but
Looking for a bachelor's level, I believe caseworker, master's level, but I didn't see any mention through the entire proposal of working to employ individuals with lived experience, which is something that's really, it's caught on out there. They're able to make those connections.
absolutely. That's something I'm super passionate about, and that's something that I've already done. So we have a person on our staff who does have lived experience, and she's able to bridge rapport and build relationships with folks in ways that I will never be able to. And I very much value lived experience. Part of our model has been to make sure that when folks have been housed and they have worked through their process, that we can place them and work with them to put them in roles where they can be a light for other people, where they can show others the way out and how to get there. And they can model, through that vulnerability and the difficulty, some resilience for them. And also, be the person that walks alongside and says, I've been where you are. Let's do this together. So our model very much has people with lived experience embedded in it. We have folks within our clinic every single week who have lived experience, who have leadership roles in working hand in hand with folks. And we have a person on our staff who does have lived experience. And that is certainly something that I would be working to look for in these positions.
Of the individuals that you've housed, how many have been rehoused? How many of these are rehoused? Individuals that have been housed out, back again?
So within the data that I showed you tonight, so 32 housed within 2024, none of those were rehoused. So those were all new housing connections, and none of them have lost housing.
Okay, but
Within the following year, we did rehouse one gentleman because he is 82, and we moved him from a mainstream unit with steps to an accessible high-rise.
Go ahead. No, I was just gonna say, someone gave me the number that you all had housed over the past few years, about 400 people,
No,
and
we've housed over 200.
over 200.
We've
and only
certainly
one is
worked
being
with over 400. I mean, we work with many, many people along their journey to help them get where they need to go, whether that's treatment, a nursing home, a higher level of care generally. We work with, many, many people in those capacities. We also work with a great deal of people whose housing is unstable, but they're not homeless. And so if you've seen a number around 400, it's probably been an estimation of people we've worked with generally.
I just want to piggyback off of Councilman Jackson's question. So out of those 200 people that have been housed, how many have had substance use disorder? Because this is what this proposal is about, and
Sure.
the funding's going to go towards.
Sure. I don't have that number for you off the top of my head, but I can tell you it's in the 90s, certainly. And certainly within the population of people we're serving through our solution-focused street outreach program, I mean, that program is serving primarily people with polysubstance use disorder. We're no longer really seeing cases of just opiate use disorder these days, and I'm sure Dr. Miller could elaborate on that. But what we're seeing is a great deal of polysubstance use, things like fentanyl, methamphetamine, heroin, all mixed together with God knows what, and most of the time folks don't even have really an understanding of what it is that they're using. And so, so it's rare to see just straight opiate use disorder these days.
And the other thing I want to bring up too is there's 3 municipalities in the state of West Virginia now that employ some sort of form of social worker or case manager on the street level.
Mm-hmm.
Those are Huntington, Martinsburg, and Morgantown.
Mm-hmm.
All 3 of those positions are embedded within law enforcement. Matter of fact, they are housed in the police department. The one in Huntington, they call it a mental health liaison, but they're doing pretty much the same thing. They're doing ride-alongs with law enforcement, addressing those issues and stuff. This proposal here talks about, having a partnership with the Clarksburg Police Department. With these other 3 municipalities, with these already being embedded within law enforcement, has the city manager, yourself, and the chief of police have had conversations of what defines being embedded in law enforcement? Because I'm going to tell you one thing right now, probably most of the clients that you probably see out in the street that have substance use disorder that you're probably working with has had some sort of form of contact with law enforcement.
Oh, absolutely.
And if we're going to try to get these people, these folks off the street and into treatment, and the triage that, most of that's going to be, the first initial contact's typically going to be from law enforcement when they get a call. So will these 2 case managers, because I'm thinking that the licensed clinical social worker is just going to be doing more specialized care in the street level. So these 2 case managers, are they going to be devoted to, where are they going to be housed? Are they going to be housed in the Clarksburg Police Department? Are they going to be housed at the church? Is the Clarksburg Police Department and the chief going to be involved in the interviewing and in the hiring process of these folks? Because if their officers have to work with these folks, they pretty much want to build a rapport with them, because I hate to say it, law enforcement has generally have the most contact, with a lot of folks that are dealing with a crisis or a substance use disorder that's turning into a crisis. And these other 3 municipalities seem to have, when the call is made, they usually have a social worker or a case manager or whoever that's out there with them responding immediately.
Sure. So I will say that Mark and I work very closely together already. So part of this is an expansion of what we're already doing, but that person would be available Monday through Friday, 8 to 4:30, when they are called by Clarksburg Police. I'm sorry, 7 a.m. to 11 p.m. When they're called on by Clarksburg Police, they would absolutely respond at that point. I am, very willing to work through the details with the Clarksburg Police Department and staff about where this person's desk sits. I don't think that having a desk in the center of the police department is going to attract many people who are in the thick of substance use disorder. Part of this process is that it's not going to be the vast majority of the time in which we're connecting people who are experiencing unsheltered homelessness, particularly the chronic subset, which we have the biggest, population of within our downtown area. Someone has already asked that person if they want to go to treatment, probably me, and if not me, probably 100 other people. And what is going to get them to treatment is not one big heroic action. It's a slow, iterative process of showing up for that person, showing them genuine care through their hardship, even when it's really difficult to love them. Right?
To add to
That's
that, Marissa, Council Worth also asked about the hiring. We did sit down with Chief Kitty, and Chief Kitty will be involved in the hiring of those people because they will be out on calls, and we feel that that's a valuable part, is to have a hiring committee with the chief, not myself, Marissa and whoever else from that program, but at least, at a minimum, the two of them, probably an additional third person, because they will be working so closely together.
Yes,
That's
but
news to my ears.
when it comes to where that person is housed, I think what will make this program work is that these folks being at street level, being accessible, being a person who makes contact with them over and over and over again. And folks are not going to show up here to meet with someone within the police department. They're just not, for all
And I-
kinds
and I
of
get
reasons.
that, you know, but we have to make sure too that these staff are also building rapport with our first responders.
Absolutely, and
Because
we
our
have,
first responders are ones who are typically initially responding to these issues.
well, the goal of this program would be that when the police get there and they have a call and it's a difficult behavior, that we already know them. And I'll tell you, just a few weeks ago, I was sitting in the chief's office and a call came over the radio. And his deputy came in and he said, hey, it's so-and-so, we're having a problem with him. And I said, oh, I know him really well. And I went down and I was able to help de-escalate the situation. And I think that Mark can tell you, we have a great relationship with Clarksburg City police officers. We work very closely with them. We've built relationships with many of them. And the vast majority of time when they're having contact with someone who's experiencing homelessness and substance use disorder, we already know that person very well. We don't just know their first name and, you know, their date of birth, but we know where they grew up and we know what happened to them when they were 13 years old, and we know the last time they saw a dentist.
And I mean, I support the work, I really do. I'm a social worker myself, but I just want to make sure that our police department, our police chief, and whoever our first responders in the city, you know, are involved in part of this process.
Absolutely.
You know, I just don't want it to turn into say, okay, we're going to give a bunch of funding, you know, to the Resilience Collaborative to address these issues, and then there's no real relationship or connection, even within the process, with any of the first responders.
Sure,
It's
and
very
I,
important.
absolutely, and I've been in direct conversation with the chief, as I always am, and we talk multiple times a week, most every week, and I think that collaboration and that foundation is already there.
And if I may, expanding on what Wayne said, I mean, I would assume, I'm not a police officer, obviously, if somebody's violating the law, they're probably gonna be arrested. They're not gonna have a chance to go into your care or the social worker's care or try to be rehoused. They're probably gonna go to North Central Regional Jail, I would assume.
That's my
They're
understanding
not
of the
gonna
law.
get a second chance by your staff to say, well, if you just come with us, that's not how it's gonna work, correct?
No, that's not my
I
understanding.
mean, that's,
That would be, you know, broader diversion work, and I think that there's room for that in our community, but that's not what
Sure,
this
and I
program
don't
is built
disagree.
on.
I was just, you know, beyond possibly, you know, public intoxication, or if they're, you know, using drugs publicly or
Sure.
something like that, they're probably gonna go to jail. But if they're just,
Mental health
if
breaks.
they're maybe loitering or something, they're probably gonna be approached by you guys and not taken to jail. I mean, I would assume that there's some kind of level where there's a cutoff.
Sure, I would assume so too, and I would leave that to Clarksburg Police to make that determination about where that line is drawn.
Okay, thank you.
I just had one more question. This is for the city manager.
Yes.
West Virginia, it looks like it's $707,981.07 that we're gonna apply for. The 10% match from the city of Clarksburg is $78,664.56. Is that $78,000 in change that is proposed, is a proposed funding request to the Resilience Collaborative? Is that going to be contingent on receiving the funds from the West Virginia
Yes, and
First
that will be
Foundation?
outlined in the resolution. In the MOU, which I gave a template in here, but once that's approved, we will expend quarterly to the ResCo. They are going to be required, like any grant will have benchmarks set out, so they're going to have to report quarterly with financials, expenses, and results. And then once council has that, then the next allotment of money will be expended to the Resilience Collaborative, or Restore Collaborative.
But no allotment of funds out of the 78,000 and change is gonna go to the Resilience Collaborative upfront until
That-
we
that is-
receive the
that is correct.
707,000.
Yes, and
Okay.
even the application to the West Virginia First Foundation, how that is going to be applied is that it's actually the city of Clarksburg applying. We will be holding that money, and we will be expending that money. All that money will not be going all at once to this program, and that's really to protect the funding. Not saying anything bad about United Way and Marissa, but really it's transparent to the public that we're a public organization. They can see where the funds are sitting, they can see the results, and we can expend quarterly as needed.
So the 78,000 and change is contingent on receiving
Yes.
this, receiving approval of the 707,000?
Yes.
Okay, thank you.
I did also want to mention, and the chief can share more about this, but he has been in touch with the chief in Martinsburg, and they are embedded within the department, but they are actually operated by a different entity. And so this model is not, it's not something new. This is a model that has been utilized in other places, and we're not reinventing the wheel here.
But it's possible to be reinvented during the process, correct? I mean, if you find that something's absolutely not working, you guys can
Yeah.
reinvent the wheel.
I mean, and that's, you know, like I said in the video, Will, I am very committed to continuous improvement. You know, my year 1 of programming does not look like year 4, right? Like there are things that we learn each and every year as we go. There are new behaviors that we see every time the drug supply changes, right? What we were seeing in the very beginning, you know, with opiate use disorder, those behaviors are completely opposite what we're seeing now with things like methamphetamine, right? And when we see those big changes, we have to evolve, right? That's what makes our programs work as well as they have, is that we have been committed to continuous improvement and to evaluating what is working and what is not, and to being able to say, you know what, we don't have all the answers on this, right? Like, this is a big, sticky issue. It's going to take all of us in one shape or form, right? Like, there's no one-size-fits-all solution to this problem, as much as we all wish that that existed.
Since you hit on that issue about, you know, evaluating the program and things of that nature, have you all considered contacting the Office of Facilities Licensure and Certification to become a behavioral health licensed facility, and also the West Virginia Bureau, so that you could actually start to build peer recovery services and make this a sustainable program? Because right now, what we're looking at is 3 years. And after that 3 years, what are we going to just walk away? Or, you know, are you building in some sustainability into this program?
Absolutely, and certainly that's my number one priority. So looking at is we will long-term be looking to bill Medicaid for particularly our therapy services, but also respite care services. So we're already providing clinical support that could essentially be billed to Medicaid should the state move in that direction, which there are numerous states across the country that medical respite care is completely billable to Medicaid now. So we're not only, you know, watching and waiting for that to happen, but we're working our program through there will be a national accreditation process released this year for medical respite care, and we're working towards that with the goal of making sure that when our state does agree to bill Medicaid for those services, that we're like first in line. Additionally, we're also looking at other grants for this funding. So SAMHSA is a really great fit for sustainability for this project, and we'll be looking at that from day one.
Well, peer recovery services are billable now.
Sure.
You know, if you get connected with, like I say, OFLAC or the BMS, you know, those are already billable services.
Yes,
You
we'll
know, and,
certainly be
you know,
working
making
towards
sure
that.
we have a sustainable program is going to be important.
No doubt. We'll certainly be working towards that. You know, for example, I have been funded to hire a community health worker on my staff. And so I haven't done that yet, primarily because I'm working to house them within an organization that's already situated to bill Medicaid for those services and then have them attached to my staff. So those are certainly things that we're constantly looking at and ensuring that we're working towards. Sure.
I have a few more comments. This is, you know, so this is saying how I expect you guys to do a good job. You know, I've worked with you and I've seen you out there, and you've had, you know, communication. But again, I always got to come back to the unintended consequences. That's what we have to speak for, you know, our taxpayers and all those things. And I worry about some of those. Now, we create this great program, which I'm confident that you guys will, that becomes known and that becomes, you know, more concentrated area for other cities. Because now I know there's discussions about there people aren't dropped off here and all those things, and we've heard that for years. At municipal league conferences, those city governments, they've said that they have admitted to it. This is more later in the evenings when they started to admit to things, but so that is a thing. But with us going to the foundation, I hope that we can ensure that other areas like Elkins or more, I mean, that this type of model is not just, you know, here, because other cities are doing it too, so we're not the only one with a great program.
Sure.
Because because some people go to bed at night feeling a lot better when they send them to a city with a program that is great. People will do that. So I worry about the unintended consequences. And I know the area, we've kind of talked about it and kind of, people have mentioned it at the church, even though I fully believe you guys are running it as it should be and it's done that way. It's a concentration of resources that the unintended consequences that will be more people over there that are causing trouble. It may not be happening on Friday from 12 to 3, but we see it. So I worry about those type of things, and I like to feel better about this if we could find ways to offset those things.
Yes, and I hear you. I mean, I live in the center of downtown, right on Washington. I have 2 very small children. I don't let my children play out in my yard without sitting outside with them, right? So I realize those consequences, and I face them myself with my young family. So I can say that we are very committed as an organization to helping folks to take some responsibility for themselves, right? They're not necessarily responsible for being down, but they are responsible for getting up, right? We'll help you, and we want to walk alongside you, but you do have some responsibility for working to, resolve this situation, and that's a message that we're communicating to folks on a daily basis, and working with folks on that. I will also say, at the church, we do have folks, who come there daily to meet with us. We have, folks that seek the lunch program there. But I will say that the church has been very committed and to helping folks also respect the property and respect our neighbors, and to learn to be good neighbors and to access those services, and then to go back to, wherever it is that they were before. But I will also say that there are oftentimes some neighbors who hang out in our parking lot, who are housed, who are folks who are coming together and who just are looking to be in community with one another and don't have, maybe the wherewithal to identify another space to do that, or maybe they're just not aware, and we're always doing our best to point folks in the right direction. We have a group starting next week around meaningful daily activities and helping these groups plug into things like the library. The library has incredible programming for people. I mean, there's painting, there's beekeeping, there's all kinds of stuff going on down there, and helping folks to see that there are other places to hang out, right, and to engage, particularly folks who are, in our housing program, who are just looking to connect with one another, and to not do so in their apartments, because we have explicitly, worked with them on, respecting their lease and respecting their neighbors, and, not having a bunch of people in and out of their apartment throughout the day and night, right? So I totally hear you. I want to be very, I'm very willing to address those things, and I think, our neighbor can stand to tell you that if there's an issue, I'm there to address it. Doesn't matter if it calls me at 11 o'clock at night or 3 a.m. in the morning. I have been responsible for making sure that the folks that we house and the folks that we're engaged with are doing their best to become good neighbors. And the vast majority of them have turned out to be really great neighbors, not only to the people they live alongside of, but to one another. And if I can say one quick thing about programs that are a magnet, I will say that these programs have been in operation in 4 years. I don't put my name on billboards or anything else. And the folks who need us, they know how to find us. We don't go and, shout it with an air horn what we're doing and where we're doing it, because the likelihood is that if a person is living outside and they truly need us, they're going to find us either one, through another provider like Dr. Miller, who's going to connect them back to me, or through one another, right? So I'm already connected to this person, and he knows another person who's living outside, so he told him about me, and he's bringing him to the clinic on Friday, right? And so that's the primary way that our program has made those connections and that we've built credibility over time. We have not had issues with folks coming to see us because they heard we were so grand, and I am grateful for that because we have enough of a problem that we're working through here. I will also say that being the only medical respite care program in the state of West Virginia, we've not seen folks coming here to Harrison County specifically to access those services, or families moving here to access our Families First partnership. So it's just not something we've seen. I will tell you also that while folks say that folks are being bused here and all that jazz, and people come here because we have such great programs, that we are probably one of the biggest exporters of folks experiencing homelessness to other counties because we have no shelter program here. So when somebody comes to me and says, hey, I just became homeless, I was just evicted, I've never spent a night outside, I'm terrified, can you please help me? I have to drive them to Elkins or Morgantown or Fairmont to access shelter. So if anyone is guilty of that, it is certainly us, right? That we're sending folks who become homeless right here in our city, folks who had homes, who were condemned and owned their homes but could not afford to fix them, who were condemned and had never spent a night outside, that we are the ones that are exporting folks experiencing homelessness.
Yeah, I don't think for 1 second that you guys aren't running it as you should there, and
Sure.
I'm not saying that, but I just, especially with the church's position, they allow other things to happen that they shouldn't be. We see it, Chief Kitty sees it, people downtown see it, I see it on First Fridays, they're down, I mean, just, that happens, and I think it's almost the overall position of the church as well, and it's not your cause, and you may have been there before it became more of a concentrated area, but now it is a concentrated area.
Yes, and the only thing I can say is that I think that, this work, it really takes everyone working in the same direction. We are going to be dealing with this for decades, right? And at the end of the day, starving folks out isn't what's going to get them clean. What is going to get them clean is showing them that there's another way to live, and that after they get clean, that there is something out there for them.
And that was going to be my next area, because we've heard a lot about homelessness, but we haven't really heard much about, the real underlying problem here, which is addiction. And, how are you set up to deal with these individuals? Do you have facilities that you can actually reach out to right now if an individual calls and says, look, I want to go to rehab right now?
I sure do.
And, one fails, do you have a backup? Do you have a backup? Because I understand how that whole thing works.
I'm a planner. I've got like 10 backups all the
Okay.
time.
All right.
So I have contacts at many, many inpatient facilities. I have my favorites that I really, like to work with, who really like to work with our population and who are willing to move beyond that 28-day model, which is just a really, broken system based on, insurance billing. And so, we have relationships with folks that we prefer to work with, certainly. But if someone needs a bed, we can get a bed. That's no big, that is not at all an issue in our community. And I tell folks that all the time because I think there's this misconception that if you were to need a detox bed today, that there might be a shortage. At one time, there was a shortage, but that is not the case today. There is plenty of that infrastructure built out, and there's good quality care out there. What we're lacking in terms of infrastructure in supporting people who are new in recovery is, say I'm homeless and I go to treatment, what a person will say to me many times is, what happens after? Like, I've lived on the street for the last 3 years. I've burned every bridge that I have. Not even my own mother or brother will let me stay with them. What happens after I get clean? Where am I going to go then, right? And so a lot of times, like, helping someone make that jump takes me saying, okay, we're going to get a better sober living house, and I'm going to pay your security deposit and your first month's rent, and I'm going to connect you to Jobs and Hope, and you're going to go see them the day that you get to your sober living house, and they're going to work with you on getting employment and training. And from there, you have a foundation to make it. right? But for someone to go from the street and say, yeah, Marissa, sign me up, 28 days, that sounds great. I'm going to go face all this wreckage that I've done over the course of the last 3 years and just have no idea what comes next. It's just not realistic to ask folks to do that oftentimes, and I think what helps folks make that jump is the fact that we can work through a plan of what comes next for them. And the biggest missing piece of infrastructure within that system and helping people make that jump is like, we don't have enough sober living. We don't have enough support to mitigate the barriers. Like, there are a lot of financial barriers to sober living. People don't realize, like, it costs $1,000 just to get into sober living. And most people who are coming off the street and going into treatment don't have access to $1,000. So you start out day one in your sober living home and you're $1,000 in the hole. So, and that's a lot of pressure for folks who are in new recovery. So I think, in my opinion, the biggest missing piece is we need some assistance to help people see what's next and to help them facilitate getting placement, even if that means, $1,000 for a security deposit and a first month's rent while they get employment in that first 30 days. And we also just need more sober living and transitional housing built out for folks who are in new recovery that can offer a structured, safe place, because oftentimes these folks might be willing to do that 28-day or that 60-day treatment, but what then?
And we're working on that plan
Yes.
as a city.
Any other questions from us?
I just have one more question in regards to what you were just talking about. So kind of programmatically, with this proposal, a lot of it will be triage and a lot of it be, yielding law enforcement's calls to diffuse, situations that are substance related that maybe they can't address, if no crime has been committed or anything that they discover. Once you get them into that 28-day treatment program, detox probably first, will the follow-up case management on that, work with the treatment center to try to establish aftercare? And my question is, with all the triaging that these I guess 2 case management positions that are doing, okay, will they have the capacity? Will the organization have the capacity to be able to help try to mitigate and set up that aftercare? That way they're not coming back to our streets again, doing the same things.
Yes, so absolutely. Not only will that person coordinate with the intake or with the staff at the treatment facility, they will take the lead on the discharge planning. From day one, we have to ensure that folks have a plan and that they do not just bounce back to right where they came, right to the situation that they left, right? And oftentimes, that is the key part that gets somebody to say yes, right? So in that messy middle part that I talked about, that's when we have to really step up our trust earning behaviors, right? That's when we have to call that person who's in treatment for the first week a couple times a week just to say, hey, I know this is a rough time, but I wanted to see how you are. It's not just that I placed you and now you're never gonna hear from me again. And so the idea would be that person would be doing the follow-up. The person who has the relationship with them is likely to stick with them, right? So if you're the one who's built the relationship with them over time and you finally got that yes out of them, I'm not gonna pull you off that case. You're gonna stick with that person and work with them to build out a discharge plan. And the likelihood is that you've already agreed to some sort of plan before they went in.
And so you believe that you and the staff, if this is allocated to you, will have the capacity to keep up with that kind of system?
This is a process that we already do. So yes, I do.
Because that, like I said, the whole intent with this is to provide, these opioid funds. And as a city councilman, my concern is not only the public safety, not only the addiction aspect of it, but the public safety aspect of it too, and trying to not continuously have these repeats.
Sure.
You see what I'm saying? We want to nip this in the bud real quick, and try to develop a plan, and not only a plan, but a strategy that's going to work to where we're not seeing folks just, you get a call from law enforcement, someone's, having a crisis, an episode, they need treatment, you get them in treatment, they're back on the street, 3 or 4 days later, or 28 days later, doing the same thing. Now, I understand it's not gonna be perfect, but I think there has to be a clear strategy, and the clear strategy, which I believe, should be trying to get these folks off our streets, okay, into some supportive treatment facility with aftercare. That way we're not experiencing this again, at least not a lot of it. From the
Certainly.
same folks.
Certainly that's work that is quick. The folks that are outside living on our streets who have been chronically homeless here, we have addressed them not once, not twice, not 3 times, not 4 times, probably 10 times. We've probably housed them, and it did not go well. And it did not go well because there was not willingness to seek an appropriate level of services that would impacts of their substance use disorder. So that is why I'm asking you for a trauma therapist, because these very specialized approach, and it is going to take time. It is a slow, iterative process to build a way out for those folks. And so I don't want to misrepresent what I'm asking you for, because there is no easy, quick solution to chronic homelessness. What I'm asking you to do is to do something evidence-based, to do something that is innovative, and to do something that many communities across the country have done. And this strategy is not new. We have employed this strategy over the course of the last 4 years, and we've done so with very good success. I don't think that you will find another housing program in our region with the kind of retention rate that we have, but certainly if you do, let me know, because I want to study them. We have worked really, really hard to make sure that folks do not get strung along, that folks do not cycle back and forth through this system, because every single time that the system or someone within that system drops a ball on one of these folks, it gets harder and harder and harder for the next person to reach them, to help them get out of this hole, right? There is so much mistrust within this population of all kinds of people, and they have every right to feel that way. Like, if folks knew the lived experiences that these folks have had and the way that the safety net has failed them on so many levels from the time that they were children, the vast majority of them, you could see so easily why they have ended where they are. And every time that we fail them, or we drop the ball, or we send them to treatment and we don't call them, or we don't follow through, it makes it harder and harder for the next person to try to reach them. So certainly that is built into the foundation of our work, and is a core belief of ours, is not dropping that ball, because that is not something that's going to foster resilience. That's going to foster more mistrust and more alienation, which is exactly what drove them to their addiction in the first place.
Will this program employ the housing first model, or is it required individuals go into treatment and then are housed afterwards?
This program does not employ the housing first model. So I am a big believer that every case is different. Every case is unique, and the direction that that case goes is between that caseworker and that client, and what kinds of supports that we feel like are necessary. And, having that level of support evaluated by the appropriate provider to make sure that we're all in lockstep on what that case needs. But it's not to say that every person that we engage in this program is going to go into housing. That's certainly not the case. Our goal through this program is to triage folks and to help them build awareness and willingness to get the appropriate level of care that they need to mitigate their substance use disorder and address it and move beyond it. And certainly if they're willing and able to do that, then our goal would be to work them towards permanent stable housing.
Thank you, Marissa.
I
Sure.
got one final comment. Sorry, everybody rolled your eyes. But, so, on a positive note to end it, I believe in the rebuilding phase, I think as community leaders, we can also play a role to help and put them back in the community, not just in the community, but active in the community, because I think a lot of us are active in the community already.
Absolutely.
So I think we, especially with Dr. Nicholson, I hope you guys work with her, because I know she's, part of the community. development things for our city. So, you know, I kind of challenge all of us to be a part of that, and please provide avenues for us to do that as well.
Yes, I appreciate that challenge, and I'm so glad that you said that, Jerry, because every time I talk to people, they always say, well, you didn't ask them. You didn't ask them to come see. So you are always welcome to come get involved in our work. Like, this work will take all of us, right? We have a massive caseload of people who are incredible people that you would love to get to know, that have taken on volunteer roles and sort of kin-keeping, caregiving roles for their peers in such incredible ways. And it's really amazing to see those connections and to see those people grow. So I invite you to come spend some time alongside them. Every Friday at First Church, we're there from 12 to 3. Anyone's welcome to come see the clinic. I'd appreciate it if you don't take pictures. Again, we're trying to restore some dignity here. But if you'd like to bring yourself and experience it, I'd invite you to do that. We serve a meal at 2 p.m. Many of our folks who have been through our program and are now in mentorship and volunteer roles are cooking that meal and serving it. It's made from scratch. It's far better than anything that I cook in my kitchen. And they're doing that alongside the folks from West Virginia Wesleyan Center for Restorative Justice. At 3 o'clock, we wrap up and we do circle conversations. We have 2 circles that run concurrently. The upstairs is invitation only, so that one's closed door for you. But the downstairs circle, you're always welcome to come to. And that's a place to be seen and valued and heard. We talk about something different every week. Sometimes we talk about change. Sometimes we talk about grief. Sometimes we talk about how the week went. And you can say nothing or you can share. And that's a really valuable place to be on a Friday, 4 o'clock, 3 o'clock. So I invite you to come.
Thank you, Marissa.
Sure thing. I also have Dr. Kyle Miller here, who is our addiction medicine provider. He operates an MAT program. He also does a great deal of our family medicine for our clients. And we have been so grateful to have community care. They are such a tremendous asset here in our community. Not only do they provide very accessible, high-quality primary care, we're grateful to have them as a partner, but they also have addiction medicine with an amazing team, folks with, peer specialists, therapists, and Dr. Kyle Miller, all of his support services. And we're so lucky to have them as an access point and to have providers who are providing evidence-based accessible treatment for the things that we're experiencing here in our community. So if you have medical questions or you have questions about the process in terms of addiction recovery, I'm sure he would be glad to talk to you about any of those things.
To kind of branch off what you were saying too about people, if anyone has interest in learning more about what treatments are available, which ones are evidence-based, what treatment actually looks like, how our programs are structured, all that sort of stuff, I'm happy to give out my email or talk with folks who are interested or, build those connections as well. So, but I can certainly attest to a lot of what Marissa has said about, bridging treatment and getting people comprehensive care and wraparound services and all the good stuff that really makes a difference.
And that's housed out of United Hospital Center?
No, sir. I'm near the hospital center, actually, but I'm with community care, which is in the minor building that's like across the street from UHC. That's just one of our locations. That's one of our kind of hub sites of addiction treatment. But we also have locations like really throughout I think we have 15 or 20 different clinics in the state of West Virginia. Clarksburg, Bridgeport, those are our northernmost clinics. And then we have a handful in like southern parts of the state here.
Thank you. Call for adjournment?
So moved.
Motion to adjourn.
All in favor? All opposed? Everybody have a nice weekend.